Maverick News. Fighting for freedom.
What I really was hoping we were going to talk about was the social, socialized healthcare as it relates to all of that.
It does tie together. You want to hear my experience with it?
Yeah.
Long COVID's expensive, folks. Not only did I have that expensive hospital stay the first time when I was hospitalized with COVID pneumonia, but after that, when I didn't get well, I had to go to all these specialized long COVID clinics that they now have, and they're not covered by insurance. I don't even have health insurance. It's a little different here in the United States. Our healthcare is tied to our employer. And if you're not fortunate enough to have a full-time job, and I work a little less than 40 hours a week, so my employer doesn't provide healthcare. When you get really sick, boy, are you in trouble. All these medications they were giving me were very expensive. I was taking inhalers and breathing medications that literally cost more than my rent. Okay. I was spending $2,000 a month out of pocket just to breathe. If I didn't take the stuff, I couldn't breathe. So I needed it, but it was breaking me. I have racked up $1 million in medical debt since I got long COVID, and there was no help until in 2020, Trump expanded Medicaid, and it was only temporary. Medicare would pay for the cost of COVID-related treatments, and that helped me a lot. And finally, I did get qualified for Medicaid because my income dipped that low. Even with a job, I still wasn't making enough money. So I got accepted into Medicaid, and now I have some help from the government. Not all of my medications are covered, but it's nice to be able to see a doctor for a $4 copay or pay a $4 copay on a prescription. That doesn't help me pay off the debt I've already racked up. I'm going to be paying that for the rest of my life. I'm going to go bankrupt over that. But if it wasn't for that socialized medicine, I probably would have hung myself by now. I would have just given up on life. It feels like there's nothing you can do to overcome a debt like that, the costs like that.
So where you live, do you have there must be private health insurance that you can buy
Oh, yeah.
So
Really
tell
expensive, though.
what does that cost?
Depends. For someone my age, especially now that I have pre-existing conditions, good God, a few $100 a month at least. So I couldn't afford that either. And I opted out of Obamacare because I couldn't afford it. I mean, when you are chronically ill and you can't keep the schedule or the workload that you used to, and you're applying for disability because you're literally disabled, you need a helping hand. And the private sector, wonderful as it is, doesn't step up and help people like me. It's up to the government to step in, and thank God they did and helped me. It took 1.5 years to get approved and to get that government healthcare working. But I have to tell you, as a libertarian, I always opposed socialized medicine. I always thought that the private sector would provide for the sick and that they would treat us for free or low cost, but they don't. A long COVID clinic is not going to cut you a break because you're poor. They're going to charge you a cash price.
Yeah.
And that's expensive. So it's one thing to be suffering with the disease itself. It's another thing to be broken financially because of the disease. So I honestly have to tell you, thank you, Franklin Roosevelt. Thank you, John F. Kennedy. Thank you, Lyndon Johnson, for making sure that there's a safety net for people like me. And you guys in Canada, I know you bitch a lot about your healthcare system and it's not perfect and there's long waits for procedures and things that you need. And I get that frustration, but at least you have that. America's like the only civilized country in the Western world that doesn't have universal health care.
I
We're
still
not taking care of
disagree.
our people.
I still disagree with you
Wait
on
until you
that
get really
point.
sick.
I've been sick, and I've actually been through both systems to some
Yeah.
degree. Yeah. You can't tell me that we've got a good system when you have a heart condition, you only have one place to go,
Right.
and they tell you that if you don't get a thing in the arm, they're going to let you die.
Right. If you need a transplant, you're really in trouble if you don't take the thing in the arm. You won't get the transplant. And that is scary. I agree with you there, Rick. That's always been my fear as a libertarian of
Do you think we get, let
socialized
me ask you a
medicine is
question.
they can
Let me
cut
ask,
you
let,
off.
yeah, let me ask you a question.
Mhm.
Do you think we get our medications for free?
Oh, hell no. I mean,
No.
here in America, we pay more than any other country for medications.
Like we pay for medication here. You understand that, right?
Mhm.
Yeah.
Yeah.
It
And your
depends
government
on,
supposedly is
depends.
negotiating a deal with these
Mhm.
manufacturers of medications to get you the best price possible. But do you really, are you really getting the best price possible?
And so when the government, um, see, even like, so if you are here too, you know, our healthcare is tied to our employers because you get a benefit package. And if you have a benefit package, then you get um, your medications maybe covered, right? Which can be a great thing.
Mhm.
That's through your employer. So the employers still pick up through their plans, sometimes huge bills on the medical side. But when the government says that they're going to, well, they're doing it with dental care right now, federally. Jagmeet Singh, NDP, they want a dental plan, like socialized dental care expanded. Employers pick up that cost right now through their plans. So when the government picks that up, what are they really doing? They're taking the burden off companies. And who pays for that? We pay for that. Taxpayers. Or they just borrow the money and sink us further into debt.
Right.
Depends on how you look at it. My mom, did you hear the interview that I did with my mom about her knee operations?
I did.
Right. So there's an example, right? She went for years waiting, suffering, seriously suffering in a
Yeah.
lot of pain and couldn't get access because the demand and price mechanism is broken in healthcare in Canada. And the government, the only way that they can deal with it is by rationing. So people, here's the thing, Lori, and this is what people in the States don't understand. And this is what people are not told here because it's hidden. But the truth is, those long waiting lists, people die waiting.
Yes.
Not only that, the government decides who lives and who dies. They decide. They decide what your life is worth.
And if you're old, you're probably at the bottom of the waiting list, aren't you? They're going to prioritize the young.
Or they just outright refuse. They might not even tell you they refuse, but they just don't provide. Depends on how they assess you. They decide who lives and who dies and who gave them that damn right. And it goes on every day here. And so even if and here's the thing, maybe you get up every day, all your working life, and you put in a full day every single day and you work hard and you save your money and you do everything right and you even have the money saved up because you maybe saved for your retirement and you invested your money wisely, and you didn't splurge, you didn't do anything irresponsible with your money, maybe even have the money, and you need a heart operation, and they're telling you you can't have it, or you have to wait, but you can't even pay for it, and you die. And you could pay for it, and you worked for it, but you can't even buy the service if you want to, because they forbid it, because of a concept here called universality in
What
healthcare.
is that?
Well, you see, if you're a true dyed-in-the-wool socialist, you believe in not just equality, but equity.
Mhm.
In other words, they say that everyone here has to be treated the same. And because of ethics, it would be immoral to have a two-tier healthcare system. So everyone has to get in line, and everyone's supposed to be treated the same, and everyone has to wait the same, just as everybody else, based on medical assessment and so on, or whatever their criteria might be. And so as a result, you can't jump the queue. It's illegal.
I see.
A doctor's not allowed to provide the care to you. Even if you went to a doctor, you couldn't say to a doctor, "Doc, my ticker's not functioning properly. I'm going to die tomorrow and I can't get an operation. If I give you 100 grand, will you perform the operation in my garage? And just don't tell anybody about it."
Hmm.
It's illegal. You can't, he
Wow.
couldn't, that doctor can't open a clinic to treat people like that. And so people do die. It happens all the time. People don't like to acknowledge it. They don't like to talk about it. The government doesn't talk about it. You certainly don't hear about it in the media, not very often. But did, I did some special reporting on healthcare going all the way back to the 90s. I compared the US and Canadian systems and some documentaries that I did back then for
Hmm.
CTV. My opinion, very much different than most people's. I don't believe that people should be left without care. I think we need a hybrid system where you have a safety net for people, but also private care. And here's why I believe this. It's because because in Canada, the government uses healthcare as a weapon. Now,
Hmm. Yes,
they
now they sure
control
do. Yes.
they can control you with it. It's the
Mhm.
key to everything on that side of the equation. Get this
Yeah.
in the shoulder or else. And it also it's a collectivist mindset where they say that you have to do this because you need to do it to protect other people, or you need to change your lifestyle because if you don't, you're a burden on the system. And that's irresponsible and selfish.
Mm.
You shouldn't eat too many cheeseburgers because you're a burden on the system if you do.
Right.
And when you only have one place to go, they can control you and force you to change your lifestyle. They talked about imposing greater taxes on people, fines on people if you don't get the thing in the shoulder. They were going to do that in Quebec.
Yes, I
And
remember.
they can
Mhm.
do that because you don't have a choice. We must have choice. There must be options. You must have the freedom to opt out, to go someplace else if you want to. Otherwise, you have only one place. And when that place is the government, they can and will and have shown that they will use that as a weapon against you in order to coerce you into certain behaviors or actions. They will take away your freedom. They will enslave you with healthcare. Healthcare, by the way, that you pay for with your tax dollars every single day, all your life. It's not free. You're paying for it one way or another, or you're paying for it with your children's or your grandchildren's or your great grandchildren's futures, because they're borrowing to give you something today to buy your vote. It's no different than the liberal politician in the last provincial election who wanted to buy everybody snow tires, saying that it was a safety item, a safety issue. No, he's buying votes. I don't know where it stops, but it starts with healthcare. And it starts there because they know how powerful it is, how appealing it is to people conceptually. But I also see how dangerous it is because it gives so much power to government.
That's my biggest fear, Rick, is that now that I finally have health care, I'm so afraid the government's going to take it away from me if I won't take the
Yep.
shot.
Yep.
I feel like we're just one step away from government making that a requirement if you're going to receive government benefits of any kind, food stamps, you know, family help, healthcare, Medicaid, Medicare, that they're going to say, oh, if you don't take the shot, you can't get your benefits.
See, here in Ontario, healthcare is actually more of a provincial jurisdiction, not a federal. There are transfer payments that come from the federal government to the provinces, and then it's handled provincially. So here in Ontario, though, the system is absolutely broken. It doesn't work. And that's the other problem with socialized healthcare is you're seeing the Canadian system. It has been run into the ground. It's on its last legs. It doesn't work in the long run. People think that it's just going to be there forever, but it's not. And even this week, Ontario Premier Doug Ford started talking about the need to inject some privatization again into the system because they don't know what to do to fix this. There is no real long-term answer to the socialized healthcare issue because anything managed by government is always
Is managed
inefficient.
poorly.
Yes.
Right.
So everything ends up being more expensive. Case in point, I sell hearing aids around my car show. I sell my hearing aids for a couple $100. The same quality of hearing aid, if you go through the government programs here, between $4,000 and $5,000. I started selling hearing aids because my dad needed hearing aids. And I hope I'm not talking out of school, Dad. I don't mean to talk about your health care, but this is how I started. And even if he got the government assistance, it was still out of reach for him being retired at his age and
Right.
with
They're
his income.
expensive. And the
And he was like,
government doesn't cover them here either in the
so he
States.
was like, no, not going to do it. Not going to do it. Well, when Trump was president, he changed the rules to allow people to buy hearing aids without jumping through all those those regulatory hoops, right? So that you had to get this test done at a certain clinic and get with the person with the piece of paper on the wall and all of that stuff, right? So he made it an option so that people could purchase these hearing aids without all of that. You take all that bureaucracy out of the equation, and I can purchase them in quantity direct from the factories, and I do, and I can sell them to people for a couple of $100. And
that's more like it.
And they're digital. They can be tailored to suit the particular needs of the person, and you can get tested and then buy the hearing aids for less through someone like myself, right? Because it's out of the realm of government.
I'm almost surprised government lets you do that.
Yeah, well, it's on the US side though, right? And so
Yeah.
we ship to the US
I see.
and it's because of those new regulations over there that allow us to do that. So they're the same quality. That's why that's an example right there. You take that and multiply that or just superimpose that on a macro scale over the healthcare system. Think about that. Think about that. I needed an operation on my hand. I couldn't get it in Canada. This is years ago. I went to Florida.
Hmm.
In Canada, I had an alternative procedure that would have laid me up for a long time. They would have cut my hand wide open and everything. And I had to wait. I was like a year to
Wow.
get that lined up. I made a phone call. I found a cutting edge doctor down in Florida, made a phone call, made an appointment, got on a plane. I was down there in a week. I walked into his office. He performed the procedure. I videotaped it myself while my hand was frozen, and he did the operation. I came back and did a whole series of reports on it. It was incredible. And I was in and out of his office the same day.
Mm-hmm.
And then um, got on a plane and came back home, paid out of pocket for it. There's your two-tier healthcare system. If you have the money, you can fly to another country if you're rich. So
Right.
who gives a damn if you're an elite? Well, like elite, right? It wasn't that much money, thousands, but you. So if you have the cash, what do you care if there's universality in Canada? The peasants can deal with universality. I'll
I
just hop
see.
on a plane and fly to another country and pay a surgeon over there to get whatever I need.
Which they do.
So, of
Yeah, of
course,
course they do.
happens all the time. If you got the cash, you don't give a damn.
Right.
So then all the politicians can talk about universality and all the peasants can deal with it and think that everybody's being treated the same. No, all the peasants are being treated the same. The rich people, they get all the free stuff that they can get. And when they can't get it anymore, or can't get access in a timely manner, they just fly someplace else and get premium healthcare some in another jurisdiction, like usually someplace in the States. The
That's
systems
exactly
don't,
right.
yeah, the systems
Mhm.
don't really work for the people, not
Yes.
properly. And here's why the other reason I think we need to inject more privatized healthcare and premium healthcare that people can pay for. If you keep that healthcare here and people pay for it here, you can tax that here and take some of the money generated from that here and put that back into the system to then benefit people who can't afford to pay. And
There
that
you
will
go.
help them get the care that they need. But
Yeah.
right now, the rich people just leave and they take all their cash with them. It doesn't do us any damn good. Because why? Because the socialists, they never think about what comes next. All they did was start a system and say, everybody has to be treated the same, and that's it. And here's your socialized health care. We'll just provide it. And then they didn't say what comes after that. They never think long term. They never think next or what's the impact from this going to be. And there are always unintended consequences.
Socialism for the rich, right?
And it's the rich who seem to benefit the most under these socialized systems
Mhm.
because they get a lot of free stuff too. And they don't have to pay. They still avail themselves of those services and the benefits of all of that. And they have so much that if the system fails, they still have the means to exit the system. But most
Correct.
people can't.
But we don't.
And because we can't, they hold that over us. They use that as a weapon. And now that, there was talk about you don't get the thing of the soldier, you don't get your welfare check. You don't
I've
get the
heard talk about
yeah,
it. Some countries even tried that, but it didn't didn't last long.
right.
People said no.
So,
This stops when we say no, people.
yeah. So both of these systems, the Canadian system, the US system, serious problems both sides from what I see.
Yeah.
But it doesn't mean people have to be left behind. And I'm not so hardline. People, oh, you're so right wing. You're so, no, 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 no. There are ways to take care of people. The problem that we really have is we keep looking to the government for all of our solutions. And we keep letting these politicians sweet talk us during elections and buy our votes with promises of health and security. All we have to do is give up our freedom and turn over
Don't
all
get
our
me
money.
started. I mean,
Yeah.
I'm just going to say this. The Democratic Party in the United States has been promising universal health care, promising to deliver that since 1992 at least. And there was talk of it. Even Ted Kennedy was trying to do it in the early 70s, just didn't have the votes to get anywhere with it. But every time when Bill Clinton was running for president, when all the Democrats like Nancy Pelosi were running back in 92, when they first came in, they got elected on the promise of delivering universal health care. And of course they didn't. They lied. They lied to us. They used us to get our votes. That's one of the reasons I did vote for Bill Clinton in 1992, much to my regret. But yeah, because he was promising universal health care. And every time, every election cycle, they talk a good game. AOC got elected promising she's going to fight for Medicare for All. Bernie Sanders, right? Mr. Medicare for All. What's he actually done about it in Congress? What's AOC done? Nothing. Even when they control the House, they won't force the vote. They won't take a vote on this. It is a ploy every election cycle to promise we're going to do this. And we've been waiting in America 30 years for these same Democrats talking to you, Nancy Pelosi, to keep your promise to us. And you haven't.
See this guy here? This is one of the former premiers of Ontario. Premier of Ontario from 1985 to 1990. This is David Peterson, Liberal. I loved this guy. He was sort of very pro-business. He was sort of a conservative liberal, I thought, at the time when I was young. I really liked him. I even voted for him. But this guy, he's the father of socialized healthcare in many ways in Ontario. He's the guy who set everything up that started to destroy the system. The big issue surrounding, I think it was his first time being elected, was should doctors' wages be capped?
Mm.
He campaigned against the doctors in Ontario, saying they were all too fat, too rich, and we needed to cap their wages because healthcare costs, socialized healthcare costs, were getting out of control. His solution: cap doctors' wages. It was popular with people. They thought, yeah, let's screw those fat cat doctors. They're all paid too much anyway. So the
good doctors all left the country.
That's exactly what happened.
Came to America where they can make a real buck.
Yep. Or they quit. I had a family doctor who just up and quit after Peterson was elected and capped the wages. And he said, I'm overworked and I've had enough. So he just went into buying real estate. He became a, commercial real estate investor and ran clinics and didn't practice medicine anymore and made way more money and had lots more personal time. And a lot of doctors ended up leaving because so many doctors left Ontario. To this day, we still have a doctor's shortage. They can't train them fast enough.
Is there really a cap on how much they can make? Did they pass that?
Yeah, I'm not sure what the deal is now. They've altered things since then to try to, deal with it. But on the Ontario Health Insurance Plan is what they call it, OHIP. In Ontario, everything is regulated, including what fees a doctor gets. If you go to a doctor right now to see a family doctor, or even if you go to a clinic, you get 15 minutes. You can only talk about one thing. You might have two things that you're sick with, but you can only talk to him about one thing, or her, your doctor. They won't talk to you about the second thing, even if it's life-threatening. You have to
come back for a second visit, separate visit for the second thing.
That's right, because then they get the fee for the second one.
Right?
So I deal with this one, then you go there, you make an appointment, you come back, we'll deal with the next one. That's the way it works. Some
pretty much the same here in the States, and we're paying good money for that 15 minutes.
Yeah, 15-minute appointments. That's it. But Peterson, again, it was like, here's vote for me. I'll fix the healthcare system. We'll just tell the doctors that they're not allowed to make any more money than this. So they cap it.
How's that going to work? Really, guys? You never think this stuff through. That's your point, right?
That's
the liberals never think things through.
Yeah.
You're not wrong.
But either does the public.
It always looks good on paper,
right on. And then they vote And then we got that,
Yeah.
and they capped the wages like he said he would.
Mm.
And then we got a doctor shortage. And then people go,
Nobody saw
well,
that coming, right?
I don't have a doctor, a family doctor. To this day, I do not have a family doctor. After all these years,
Hmm.
I don't have one. I have to
A
go to
primary
walk-in
care
clinics.
physician.
Yeah. So it's not that simple. And
Right.
I know many Americans, they call in here, they message me, I make these comments. I've had people, they're so in love with the idea of government-run healthcare for the US
We're
that
probably
they'll
over
accuse me of just,
romanticizing that.
yeah, they'll
Yeah.
just outright accuse me of lying.
Hmm.
You're lying. You're just saying that because you're paid to discredit, socialize, whatever, right? Like, no, there are serious problems here.
Oh
But I'm
yeah.
not but I'm not heartless. I'm just saying that,
I think
you know,
you're it's good that I think your plan is the most sensible of what we need is a hybrid system that you can opt
mhm,
out of if you choose, if you can afford to, while not shirking your responsibility as a good citizen to take care of your fellow citizens in need.
yeah,
Those who
yeah,
cannot for some reason take care of themselves. That's where government, I believe, can do good and should do good.
mhm,
And during this pandemic, it's only magnified the problem here in the United States, not having universal health care. So many people lost their jobs and then they got COVID. And that's exactly why President Trump expanded Medicaid for a while, Medicare, to pay the cost of testing and treatment if you got COVID, but it was only for COVID. Okay. So Trump gave us some socialized medicine. Okay. He was further to the left than the
yep,
Democrats on that
yep,
because Trump has a heart
mhm,
and he did the right thing. It was only temporary. Unfortunately, it went away. Joe Biden got rid of it. Like everything else good that Trump did, Joe Biden just couldn't wait to get rid of that. And so now, if you get COVID and you need to be hospitalized, man, God help you. It's going to be very expensive.
yeah,
If you survive it, you won't survive the medical bills. Um, that's something that America still has not figured out how to do right. The only good thing that we've done during this pandemic, healthcare wise, is we have made healthcare much more affordable if you use telehealth.
mhm,
For cash pay patients who don't have insurance, the greatest thing in the world is to be able to do a Zoom call with your doctor for 40 bucks.
mhm,
40 bucks out of pocket. Now the medications, that's another story. If you're prescribed something really expensive, you're not going to have any help with that. But it's great, especially if you're really sick like me. I couldn't have gotten through the pandemic without the ability to have a telehealth visit with my doctor. And it's so much cheaper than an office visit. At least it is down here. And, outside of lab tests, get you everything you need, get you a visit with a doctor. And that's a really good point that Uniquely Average makes here. A system is delivered by people. If you have bad people, you're going to have a bad system. Absolutely. And I'm old enough to remember a time in the United States when we actually had real civil servants. We had good people working in government, at least at the local level, and we still do at the state level, um, working in the healthcare system and Department of Health and Human Services, DHS. Um, you know, Unfortunately, they're being replaced or aged out. Those who really don't take that job because they want to serve the public. They're not into it for public service reasons. But I don't want to sound all doom and gloom. I mean, there are still good people in government, but they just usually aren't the ones with any power. The ones with the power are not the good people, in my opinion.
Well, in my view, and many people have many different views, um, too much government is a trap. It's a danger.
I'm with you. I'm a libertarian. You're preaching to the choir, buddy. We
And that
agree on
goes,
that.
yeah, I think it goes with for everything, including healthcare, because healthcare is so important that they will use it to control us, and they are, especially in Canada. but they will use it to control us. So it's a trap.
It is. It is.
Yeah.
Like I said, I'm scared of them taking my health care away. Now that I
Mhm.
finally got it, they could take it away at any time. Just issue another mandate and say, well, got to get the thing in the arm or we're cutting you off. That would
And that's
destroy me.
yeah. And that's kind of where I promised we would end up. We're talking about control, whether it's digital currency, IRS sending agents to your home to collect money from you, right? Saying you got to pay, or forcing us to eat things we wouldn't otherwise eat, or taking a thing in the shoulder, or making us ration how many cheeseburgers we're allowed to eat. Because if we don't comply with their Canada Food Guide, then we're just being selfish and we're a burden on the system. But it's a flipped upside down mindset where they're taking personal responsibility away from people and personal freedom and replacing it with collectivism, a responsibility to the collective.
Now you're
I'm
talking
responsible.
communism.
Right. Yeah, I'm responsible for you.
Right.
You're responsible for me. We're
Mhm.
going to have a collective, even healthcare system. So therefore, it's up to me to change my lifestyle so that I'm not a burden on you. No, I don't, all you have to do is give up your personal freedom. No, I want to eat a cheeseburger today. Should
You'll
be my
have a
personal
cricket burger
choice.
and you'll love it.
Yeah, that's right.
And some cricket fries on the side.
But these are complicated questions or issues, right? But we're seeing them play out right before us right now.
We're living it. I'm living it.
Yeah.
We're all living
I
through
just
this.
I just know that sometimes I sit and listen to people who scream and yell and they want freedom.
But they also want free stuff.
That's right.
Yeah.
They turn around and then the very next breath they talk about, but I need this program, or I need, where's my welfare check, or where's my employment insurance, and where's this program, and where's that thing, and where's my free health care? Well, folks, freedom is not easy to sell to people. Do you know why? Because it means that you have to take responsibility for yourself first. Now, I'm of the opinion that if we all take care of ourselves first, then we can help other people. It's not quite like saying charity begins at home. It's like personal responsibility begins at home. Take care of yourself, take care of your family. As Jordan Peterson would say, clean your room. Be useful, be productive. But if you do that, if I can take care of myself, then I'm not a burden on anybody. I'm not a burden on you. If I'm so productive that I can pay my own way because I'm producing, then I'm not a burden on you. I don't need to come to you for help. I don't need to go to the collective for help.
And what if as inflation is making the price of everything so much higher and you're working 4 jobs to make ends meet, where do you find the money, the time, or the energy to help anybody else if you can barely keep yourself afloat? How do you help your elderly neighbor? How do you help someone you don't even know if you don't have time to volunteer?
And that's because the politicians have abused us, right? They don't respect us. They don't respect people who have saved for their retirement. They don't care about old people who socked money away. They've made money worth a whole lot less. They just said, screw the old people. We'll print a lot of money. That'll drive the value of the dollar down. But who cares about the elderly people on a fixed income who maybe don't have very much? Who cares if their actual retirement wealth was just reduced by 30 or 40%? Who
Right.
cares if they can afford to buy their groceries? We don't give a damn. We're just going to print money and give it to our friends. They're taxing. It's a form of taxation and a way of controlling people at the expense of the most vulnerable, while they sit there and tell you the opposite. Oh, we're going to take care of you. You know what? Inflation's high. We'll just print more money. Yeah, that's what we'll do. No.
And still no health care. See, that's the American complaint. We got $100 billion for the people of Ukraine. We've got all this money for weapons. We got all this money for war, but screw you if you get sick during a pandemic.
Right.
You'd think if we could have ever passed some modicum of universal health care, it would have been during the COVID pandemic. But no,
Yeah.
our legislators had other priorities, and it wasn't us.
Yeah.
They were making more money off of their deals with Pfizer and Moderna,
Mm-hmm.
with Big Pharma. And Big Pharma does not want us to have universal health care.
Yeah. But, at the end of the day, if you really stop and look at the big picture in both countries, healthcare, it's a problem. People in Canada are dying, waiting. People in the United States are dying because they can't afford to pay.
Right.
The result,
Or they're committing suicide because they can't handle the medical bills that they're saddled with.
yeah.
I mean,
And
people literally take their own lives over that in this country. I bet
and there's
Canadians can't even relate to that, can you?
well, no, it's not, you'd be surprised if you have certain medical conditions. There can be really huge expenses associated with it. Your doctor visits might be covered, but your medical supplies, some of your medications, sometimes that's not. And people
I
have
see.
huge expenses. It depends on your personal situation.
Hmm.
It's not all roses, bed of roses over here
Oh, I
with the
know
healthcare
that.
system as people think,
Yeah.
it
I've
just
heard the
isn't.
horror stories from my friends in countries with socialized medicine, England, Canada, Germany, and France. Um, I know there are horror stories to be told, and I feel that and I respect that. And I know there's problems to be fixed with your system. But honestly, to us Americans, we're kind of jealous. A lot of us are, those of us who are dealing with high medical bills, who are being buried in medical debt, who need procedures or help that we can't afford.
Mhm.
We look at you guys and we think, your system isn't perfect, but it's sure better than nothing. And down here, you got nothing. If your employer's not paying for it, if you can't afford your own private health care, you got bupkis. You got debt. The kind of debt that you're going to carry past the grave, and your kids are going to be paying it off because your creditors will come after your kids when you die to get that medical debt paid.
I can see how you can rack up a big debt. I got sick in Texas once,
Oh,
and
God help you.
needed an operation when I was down there. But I'll tell you, it ended up being one of the best experiences of my life
Yeah.
because I had insurance.
Yes.
But if I didn't have the presence of mind to handle it the way that I did, I could have been in extreme debt. Because when I had to get first, I went to what do they call it, a merge care or whatever it is, or some place,
Hmm.
right? And then they had to transport me by an ambulance to San Antonio.
Mm,
And then so there were fees associated with that.
right.
But then I got to the hospital and all they wanted to do was treat me. And I was like, well, wait a minute. I have insurance. And they said, we'll worry about that later. I said, no, you won't.
Mhm.
We're going to deal with it now. And it's a good thing that I did, because if you don't follow the right procedure, if you don't get the insurance company, the Canadian insurance company, to approve what they do first, they don't have to pay.
Yeah.
And they kept at the hospital saying, no, you need to do this now. You need to do this now. You don't have time. You have to do this now. Just sign here. I said, no, let me die first. Right? No, you're calling this number first.
Yeah.
Then I'll sign after they approve it. But when I was there, I have to say, the care that I received, unbelievably good,
Hmm.
stellar.
If you've got insurance, usually you're taken very, very good care of.
world class,
In America, you
best
bet.
in the world. Yeah. They
Absolutely.
had, they, and here's the thing about the Canadian system too. This is also why you need to take note of this. I had been sick for better part of 2 years. And I kept going back to the doctor. I kept having attacks for this medical condition. And they kept sending me home with antacids
Hmm.
or just, I don't know, just they never diagnosed me. And then I got down there and it would come and go, right? I'd have these terrible attacks when I'd be in incredible pain.
Hmm.
I got down there and I almost freaking died.
Wow.
And that was over 2 years because the doctors and 15-minute appointments through walk-in clinics never wanted to take the time to actually deal with me. And
Yeah.
I'd been to emergency rooms several times. And they,
They
I
just
don't
want to get you in and
know.
out.
That's right. And then
Yeah.
it's like, just dismiss this guy and out I go.
Yeah. They didn't never
All
have
right.
time to get to the root of the problem.
Right. I went
Yeah.
down there, their system. I was on the verge of dying. They diagnosed me, got me in. I had this incredible surgeon, laparoscopic surgery, no scars, rock and roll, baby.
And you're better? You
Oh, yeah.
fixed?
They fixed me
fixed
right
you?
up. They fixed me.
I'm so glad.
Yeah, well, I was pretty glad too, right?
I hate
But
to see anybody suffer with a chronic illness.
but when I think about what was going on back in Canada because of the 15-minute healthcare system, right? I
Yes.
might have died.
But honestly, here in the States, we'll pay $150 out of pocket cash for an office visit, and we only get 15 minutes with the doctor.
Yeah.
10,
Yeah.
15 if we're lucky. He
Oh,
doesn't
sure.
have time to get down to the root of our problems here either, even though we're paying through the nose for that service.
Yeah.
But yeah,
But
you don't get
I'm
any
just saying
more
it's
than
not
10,
it's not
15
even
minutes.
it's not about the 15 minutes so much. It's that no family doctor, no continuity of care. It's like that you go in. So I only have access to walk-in clinics or emergency rooms where they really don't want to deal with anything too complex.
Right.
So I didn't have a good place to go. And I just kept getting sicker and sicker and sicker. And if I'd had the operation here, they would have had to cut me wide open. But I go down there and they've got all the equipment because I found out after, the follow-up appointments when I finally got home, what they would have done to me here, night and day. Like cutting edge technology there, scalpel over here.
Yeah.
Just let us put you to sleep. We'll cut
Laser
open.
surgery versus hacking you up with a saw.
That's right. So somewhere, but there has to be some middle ground someplace for people. Right.
I think it defines us as what kind of a society we are. The whole world loves to say how selfish Americans are. And that's true. Americans are pretty selfish. Before 1937, before we had Social Security, we had old people just dying in their beds alone. We had people dropping dead in the street. Because before that, of course, the commonly held belief was charities will provide for the poor, for the elderly, for the sick. There are lots of churches, private charity, neighbors taking care of neighbors, family members taking care of family members. But the truth is, most people don't do that. The churches can only help so many. They can't take care of everyone who needs it. A lot of elderly people don't have family to take care of them. A lot of sick people don't have any place to turn. That's why government had to step up. That's why we had to create Medicaid and Medicare back in the 1960s, because so many Americans were falling through the cracks. We all wait for that great moment when all the nice people are going to dig deep into their pockets and they're going to give a donation. Most people don't donate. You run a show that is powered by donations. How many people out there listening actually donate $1 or $2? And you're not even in crisis. You're not like saying, I need a lung transplant, or, you're just running a show and asking for a few bucks. But let me tell you, Americans, as a general rule, do not want to take care of their fellow Americans. That's where I'll leave it. That's my argument. I wish I could say better things about my fellow Americans. I wish that, Dr. Ron Paul, whom I admire a great deal, he's a big believer in that, doctors should, and like he does, he walks the talk. Dr. Paul has always treated people who can't afford care for free. And it's a personal decision his medical office makes on a patient by patient basis. So he does give back. He does pay it forward. He does treat a lot of uninsured people at no cost or at a low cost. But most doctors don't. And most neighbors don't take care of their neighbors. That's the honest truth, which is why government must compel it. That's why socialized healthcare exists. It's to force you guys to be better people. It's a shame that the government has to step in and teach you to be nice, teach you to act right, force you to give a piece of your paycheck for the greater good. But if they didn't, the result would be a lot of chronically sick and dead people who didn't have to die and who didn't have to go without treatment. Americans are like, screw them, let them die. Ain't got time for that. Going on vacation. Got to buy a new car. It's all about me, me, me.
Well, healthcare is always a hot button issue, and a wide variety of opinions, as we're seeing even in the comments tonight. And some of the things that were said here, I think people maybe were uncomfortable with, and other people were kind of like, yeah, they can relate to that or they understand. So a wide range of opinions.
I think the opinion has a lot to do with your own personal experience. I think I was dyed in the wool, hardcore, no socialized medicine libertarian for a long time, until my own experience put me in the category of those who need help for the first time in my whole life. Thanks, COVID. I learned a lesson, right? I've changed my point of view on it. Now I see that there is a need for it in the United States, a desperate need, now more than ever. And even if it's not for every American, a lot of Americans would rather not have it, would rather opt out of it, would rather keep their doctor, as they say. That should be your choice too. That's freedom. But you also have a responsibility to take care of your fellow Americans.
Well, folks, I think with that being said, we're kind of at the end of our night.
Oh man, we did 4 hours again.
Yeah.
Well, it was a great conversation. Thank you.
Yeah. Well, I appreciate you sharing your personal experience, and I hope it gave people a new perspective. It's a perspective we certainly do not hear on this program ever, honestly.
Well, I don't want to sound like some sort of silly liberal, because I'm not. I'm definitely not. But I'm also a realist.
Yeah, I appreciate your honesty, because I can tell you, and I think you know this anyway, that your story might not sit well with some of the people in our family, right?
Yeah.
But
And I
that's what
can't imagine why not.
Yeah.
Maybe they just don't think long COVID's a thing. Maybe they don't think COVID is real. Some don't. I know there's people out there to this day who don't believe COVID's even real, and that all of us are faking our illness, and those hospitals are full of actors. What the fuck?
Yeah.
What planet did you come in from if you believe that? Aren't those real graves? Yeah, they are.
So we always welcome a variety of opinions here, and that's part of what freedom is about.
That's right. I get to, try and convince you. You get to try and convince me. We keep it. The debate is always interesting. It's civil. That's how it ought to be.
That's right.
Yeah.
So
that's how we find solutions.
you can donate at freedomreporters.com. I probably should have put that up earlier when you were giving your heartfelt pitch.
Oh, no, don't send me money. I'm not that bad off. I'll survive. I made it 2.5 years through the worst of long COVID. I figure it's got to keep getting better, right? And keep a positive attitude.
But we'll take the money to support the show to cover the costs here at freedomreporters.com. If you haven't subscribed, it's up there right above I think it's above my head. To like and subscribe to the channel on YouTube, or go subscribe on Rumble. That helps us out a lot too. That's about all I have to say about that tonight. Any final words before we sign off tonight, Lori?
No, just wanted to say thanks for joining us, everyone. Thanks for giving us part of your Sunday night. It's been a pleasure.
Yeah, it's been an interesting conversation. More to come tomorrow, 6 p.m. Eastern Standard Time. Catch you on the flip side.
This has been a Maverick Multimedia production.